Good morning, Coalition. It's great to see everybody, and we have a really special guest, Rose Hoban from the NC Health News, joining us today. But first, let's have a quick announcement from Virginia about our upcoming meeting.
Sure. Good morning, everyone. Just a reminder that our monthly meeting for April will be the combined meeting with the Coalition on Aging. That will be on Friday, April 22nd. That differs from the 15th as it's currently scheduled. We will send out an updated meeting invite with additional details soon. That's it for me.
All right. And Catherine gives her apologies. She is on an AARP call this morning, so she can't be with us. So anyway, so Rose, it's great to have you with us. We've been planning this for a while, and now you're here. And so I want to ask you a couple questions. Tell us about where you grew up and what you wanted to be when you were a young person.
What did I want to be? Well, I always tell people I didn't really figure out what I wanted to be until I was about 35. So I'm in seriousness, like, you know, when young people are like, and I'm like, sometimes it takes time. I grew up on Long Island, just outside of New York City, and ended up going to Columbia for engineering when I was it's a long story, but I ended up finishing up in the architecture program at Columbia, but got interested in sort of social service because when I was at Columbia in the early 80s was when you know, there had been a big deinstitutionalization of people with mental health disabilities, and so I was part of a group of students that helped to start a soup kitchen, a feeding program, or we called it a community lunch on the Upper West Side in a church. And that program still continues today.
Cool.
As an offshoot, it's sort of a formal program out of Columbia. So I got really interested in a lot of these issues. And so when I graduated, I ended up being a Jesuit volunteer. If anyone's Catholic, Jesuits are an order of priests, and I ended up going off to Micronesia, group of small islands in the middle of the Pacific, for 2 years to teach at a trade school. So I was sort of plying my architecture engineering trade. But while I was there, I got roped into helping out in the clinic because the nurse who was on the campus, and we were in the middle of nowhere. We're on a little island in the middle of nowhere. And then we were 2 hours from town in the middle of nowhere. And so the nurse who was on campus, who was the wife of the principal, another couples who were volunteers, she had a baby, she needed some help. And she said, you know, it said on your application, you're interested in medicine. And so I ended up helping her, and I really liked it. And then and she taught me all kinds of stuff, and then she had to leave. But she taught me how to do stitches on a frozen turkey leg, and you know, and I had to diagnose some basic things. I diagnosed an appendicitis and got the kid into the hospital in town. You know, it was sort of like, oh, this is really cool. And then I spent a 3rd year with the Jesuits in Thailand on the Thai-Cambodian border, where there were, you know, millions of Cambodian refugees. And I was in a place called Site 2 that had about 200,000 people in 2 square kilometers. It was rectangle. It was the most densely populated place on earth for a time. Wow. And really got interested in healthcare there. Figured out that people had pretty much figured out how to house themselves. I mean, with thatch and bamboo and whatnot, but that what they really needed was healthcare. So I came back to the States and took a few more classes and ended up going to nursing school in the early 90s, doing one of those first programs that was a 2nd degree program where you sort of piggybacked your nursing degree on top of your other bachelor's. So, you know, it was down and dirty. Huh?
Where was that? What school?
That was at the Catholic University of America.
Oh.
They had one of the first of those programs, and I was able to get an RN degree in 15 months, which was pretty intense. So that's what I did. And I really graduated from nursing school in 1992. So this is my 30th anniversary this year of being a nurse. Ended up staying in DC for a few years. The exhibit I ran off and got was, this is a photograph of me at DC General Hospital in the emergency department, where I was a trauma nurse with a couple of my colleagues. I think it's the only photo I have left. And really got, we were the only public hospital in the district. And so we did trauma. It was when DC was the murder capital of the country. And, you know, there was a lot of crack cocaine. And so I really cut my teeth there, and ended up moving home to New York to work there. And I had a various number of jobs. My last full-time job in New York in the late 90s, like I worked in drug treatment, I spent a few years in hospice, but my last job was at, was with the Visiting Nurse Service of New York. And I was in a complex of buildings called Penn South, which is, if you're familiar with New York City at all, there are these groups of high rises kind of in sort of, you know, in the park, is what they call them. But it was a group of 10 buildings that's just south of Penn Station. And the buildings, when they had built them, they needed to have the organizations that built these buildings under this Mitchell-Lama law. It was government, and then there needed to be a beneficent organization that sponsored the building. And for those buildings, it was in the Lower West Side. It was right near the textile district. And so it was all the needle trains unions that were the sponsors of this building. So all of these people who'd been unionized textile workers all moved in the early 60s. They were rent subsidized cooperative housing, and they all proceeded to age in place. So Penn South was one of the original NORCs, a naturally occurring retirement community. I see Karen shaking her head, nodding her head. And you know, there's a bunch of NORCs in New York because of this Mitchell-Lama law. And the co-op board at Penn South realized in like the 80s, like, oh my God, we've got all of these people. We've got this cohort of people who are over 65 aging in place. And so they created a clinic and a senior center, which was really fabulous. And all the buildings were elevator. So, you know, people had access. There was no worry about access and disability access way before the ADA was passed. And so, you know, and what was great about my old patients, and I joke, is that primarily my patients were what I used to call aging Jewish socialists. There were a lot of people who'd like been union activists. They'd been involved in politics all their lives. I had one patient who had come at many Holocaust survivors. Wow. I had one patient who had come from Poland in 1938, had, you know, moved to her family. Yes, the VNS is an amazing organization. So that she moved in with her family in New York in 38 and, you know, got a job with the union and quickly got involved in union organizing and met a Black man, and which much to her family's chagrin. And they fell in love, and they both were very involved in union organizing. And she ended up writing and becoming, she was the Moscow bureau chief of the Communist Daily Worker during the Stalin years. I mean, I had like the stories that my patients had were incredible. And I started, and that's where I got really interested in storytelling, because like I had another patient who was a physician who had trained at the University of Vienna between the wars. She'd had therapy with Anna Freud, like,
Mm.
right. She was amazing. And she, this is a really moving story. What I would do is these interesting patients, I would schedule them for the end of the day. And then I would say, I'd throw my schedule out the window and would sit and listen to them tell their stories. And I'd ask them stories. And this one woman, she kind of was a little bit of a hoarder, this physician. And so I'm sitting there one night and she's telling me her story. And she told me that she was Jewish, and the head of the Jewish community in Vienna had come to her and said, in 37, and said, "You're in danger. You need to go home." And she had a lover, she had friends, she didn't want to leave Vienna. And he impressed upon her the need for her to go, and that by being here, she was endangering friends and whatnot. So she packed her bags and left. And a week later, the Germans came into Vienna and rounded up all of her friends, her lover, this gentleman who had told her to go, and they all perished in labor camps.
Wow.
And so we're sitting there, and she's telling me the story. I was like, wow. And she said, my diploma is around here somewhere. So she points it out. It was on top of an armoire. So I pull up a chair and I climb up, and it was this thing. It was like the size of a cafeteria tray. And I pull it down, and it was a stack of things, and I pull it down. It's covered in dust. So I get out the Windex from under the sink and I'm cleaning it off. And she had told me that the Germans had forced her to put a stamp on her diploma, identifying her as a Jewish physician and limiting her practice to Jews only. And it was like a purple stamp, and it was down in the lower, I'll never forget it, was down the lower right-hand corner. And she's like, "It's there somewhere." And we're looking for it. I'm cleaning it off, and it's there somewhere. And it had faded. It had faded to a very light purple.
Huh.
And, and I said to her, "Can we hope that this is something that's faded forever?" And, the two of us sat there and said, I really hope so. But as you see, in the past few years, we've had to keep fighting these fights.
Oh, yeah.
But, these people, their stories really moved me. And the other thing that was happening at the same time was I was seeing these patients being buffeted by policy issues. Many times the problems that they had with their health were not about health or even their physicians or whatever. It was about the policies that were pushing insurance companies and pushing providers around. And if you remember the 90s, it was the HMO 1.0. I would go in, and I tell people all the time that as you do your documentation, and I would tell people, being a nurse in this environment has forced me to learn how to lie. Oh, Mrs. Bethel says that she doesn't quite understand her diabetes teaching. She requires 3 more visits, right, Mrs. Bethel? Right? And she'd say, "Uh-huh." And I would document that. And, because maybe there were some other issues or she needed help, and you would have to kind of stretch things. And I didn't like that. And I had started taking journalism classes so that I could write my stories, my patients' stories better, and began to realize that there was a way for me to marry these two things together. And so, and it was really around, I joke, I was around 35 at the time. And I realized, oh, this is my life's work. That was really, it took a couple of years of thinking about it, but I was like, oh, this is my life's work, is to talk about healthcare. And so it took me a couple of years to operationalize it. Between, I had to pay off debt from nursing school, and I had to take classes and prerequisites and write some stories, and then, apply to school. And I got into a number of journalism programs, including Carolina's. But what I did was I I applied only to journalism schools that also had universities that also had schools of public health.
Mhm.
And when I got it, I figured the journalism would be the higher hurdle. And then the public health, I'd been working primarily as a public health nurse
Mhm.
for much of my career. So I applied to a bunch of different places, and I got into Berkeley. And after I got into all these places, I would send an email and say, hey, this is where what I want to do. I'd love to take classes, blah, 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 in public health. And I got back within 24 hours, I got back an email from the people at Berkeley saying, we've been looking for you for a decade. We've
Really?
been wanting to create a program to, journalism and public health program, joint program. We need someone to go through it and tell us what we need to teach people. Won't you come? We'll pay for you. So, and I was an out-of-state student at the time. And so Berkeley paid for, at the time, tuition, isn't this insane? At the time, this is 2000, tuition for an out-of-state student was $14,000 at Berkeley, and they paid for $7,000 of it, and I paid the other half, and exhausted my savings in the process. And then I got scholarships, and so I went there. It was an incredible experience. I was able to create my own interdisciplinary master's degree. I have 2 masters that I got over the course of 3 years. And I walked away with almost no debt, which was because I worked every weekend as a visiting nurse for the VNA in the East Bay. So it was a great way to get to know the area that I was reporting on.
Mhm.
And then so for my 40th birthday, I graduated from graduate school with no money and about $7,000 in debt, but that was enough. It was small enough that I joked that I could live under a bridge and still pay off my student loan debt. So it was a low enough debt load that it allowed me to work in public media. So
And you were still single then.
I was still single. And I had applied for 43 jobs before I found my job at WNC, because people were like, I graduated into this point in time where journalism was starting to change radically.
Right.
And the business model was quickly eroding. And we saw it first in the Bay Area because that's where Craigslist started.
Sure.
And Craigslist eroded the classified ad revenue stream for journalism organizations.
Mhm.
And so I came, it took a long time for me to find something. And I ended up doing public health research in the meantime. I worked with a group, a Center for Independent Living. As you know, the Bay Area is the center of the disability rights movement. And so I worked at one of the CILs in the Bay Area doing community-based participatory research with women we examined their access to cancer screening, breast and cervical cancer screening. And, because so often, and I think we see it with aging too, people get treated as their pathologies, not receiving the primary care that they need, and so a woman with cerebral palsy will roll into a doctor's office and there's no table that she can get on.
Mhm.
And they want to talk about her cerebral palsy. They don't want to talk about the fact that she needs screening for cervical cancer. And of course, people think that people with disabilities are asexual, right? But if you know the research, that women with disabilities are, I think, 3 times more likely than women in the general population to be sexually assaulted. And here comes the chief morale officer, the dog. And you may hear her in the background. She's having her moment after her walk. So anyway, so that was I can put on earphones if necessary. So that was a really great experience because I really had my colleagues in the disability rights movement kind of beat me over the head and shoulders, really getting sort of disability rights language and disability rights understanding of the issues into my head. And that was a really, really terrific position. And I thought, well, if this is where I end up working, that'll be fine, right?
Mhm.
And then I got a phone call from WNC. They were like, well, what do you say you come to North Carolina? And I was like, really? And then I moved here and I met him and
The Dookie.
the Dookie. And I stayed here and spent about 6.5 years at WNC. And one of the things I really wanted to do was just tell more stories. And again, going back to the changing business model for journalism, kind of looked around me in 2011, was like, when I first came to North Carolina in 2005, the NNO had 5 people covering healthcare. And when I looked around me in 2011, there was no one left. And, they'd had, as you remember, there'd been all these layoffs. And McClatchy in 2008, they bought the Knight Ridder chain and they assumed about $2 billion worth of debt, which they ended up having to service. So that was why they were cutting journalists and, there's no longer a News and Observer building downtown, right? And there's no longer a news building in any town. They've all been sold and all that money has gone to service the McClatchy debt. And, we saw in 2005, the newsroom at the NNO was about 240 people. And now it's down to about 35 to 40 people. And they're hiring their first life sciences reporter in a decade. Someone to cover, we're in Research Triangle Park, right? And there's no one covering the life sciences in this area, which is crazy. And I wish we had the capacity to do that, and we just don't, my thing has been, as a publication, I feel like we should be focusing on the constituencies that have no PR firms, representing them, right? So that's why we focus on the things that we do. So it was about 2011, and my husband and I had gotten married the year before, and I saw this happening. And there was my predecessor was a guy named Andy Miller in Georgia that I knew through the Association of Healthcare Journalists. He had started Georgia Health News. There was a woman in Florida who started Health News Florida. So I thought, well, maybe this is the time. I always say I was a couple of years ahead of my time because people really, it took a while for people to get their heads around it. I've been preaching collaboration amongst news organizations for the past decade. And there was still this, we need to compete. And what I've said for years, and Ann Ehlers is on the call, she's our development director, and she's heard me say this a kabillion times, that, I come from healthcare where collaboration is the name of the game. And if you're not collaborating, your patient's dead. And so we've been really trying to get people, though. I'm sorry?
There's still competition though.
There's still competition. Yeah. Oh, for sure. No one knows better than a nurse, right? But there's we've gotten to the place in the journalism ecosystem where there is much more collaboration. I was just I was emailing back and forth with Tyler Dukes, who's the he leads investigative reporting and data journalism at the News and Observer, and he's going to come and do a workshop for my team in April.
Great.
Right, so we're really working to, I think people are really working to collaborate because there's an understanding that there's been so much of a loss of journalism capacity in the state that we really need to work together to fill in those holes. That's really our raison d'etre at North Carolina Health News, is to fill the holes. So, you know, people will
so-
say to, go ahead.
What tell us then, what ways this Serious Illness Coalition has grown pretty rapidly over the last couple of years. We came out of the NCIOM task force on serious illness care, and we've got, a couple hundred members now.
Wow.
But it's been virtual. We haven't had a meeting in person since we got started in early February. So that was our first meeting, and then since then. But so just tell us in the last couple of minutes that we've got how we can work together with you and with others to be more collaborative, to get the news out, to get the information, the stories to people that need to hear what you're talking about.
Well, we're constantly, we constantly have people writing to us and sending us tips for stories. That's really important. What I tell people is that when you send a story idea, right, like you've got a press release is fine, but what really makes a story sing is to have a face to put to the story. So we really need to have like real live people. So that's, if you, and this is not just me, this is anybody, or, North Carolina Health News, this is any news outlet. If you write to us or you write to the News and Observer, you need to be able to say, I've got Mary Bethel. I'll just keep using your name, Mary. I've got Mary Bethel. She's somebody who had this issue. She's really, she's willing to talk to you on the record, using her name, which is really important to us, right? Because we need to be able to illustrate how things are happening. I think that's one thing. The other thing is there is still competition in the sense that I tell people, like, if you're going to do blanket coverage, right? If you're going to write to the Charlotte Observer and us and the News and Observer and Winston-Salem Journal, we're probably not going to do the story because, why we're trying to fill the
An
holes,
exclusive,
right? Well, it's not about an exclusive. We're trying to fill the holes. So if you have these big publications that are doing this, you don't need me to fill the hole. You don't need us to fill that hole, right? We're trying to get to stuff that doesn't get covered. Sometimes we have to do things because the story is just so big that we can't ignore it, right? But for example, like on COVID, as an example, we never did the News and Observer. If you opened it every morning, there was always here's where the numbers are. At least once or twice a week, there would be like, here's where the numbers are, and it was the story. We never did that story. We would instead kind of cover the governor's press conferences in depth, and then at the bottom we'd have the numbers, because it didn't pay for us to do the same story that the other people were doing, right? Part of what happened with me was when I started up in like 2012, I just showed up at the legislature. It was just me. And I walked into the press room where there were all these empty desks. I was like, can I take this desk? And they were like, sure, And so I started covering healthcare because all of these reporters who were assigned to the State House, they don't know about healthcare. They would do things like I remember in 2013, there was that big sort of omnibus abortion bill that was dropped by the Senate, a Senate committee, 2 evenings before the July 4th holiday. And it was a huge bill. It would have radically changed access to reproductive care in North Carolina. And we all ran in and, covered them, doing a 20-minute hearing on the bill. And we all came out, and people started coming to me in the newsroom going like, so what is a medical abortion? And so I said, all right, everybody. And so I basically said, come around, everybody. And they sat around my desk, and I gave them like abortion 101, right? This is what this means. This is what this means. This is what this means. I have a book. Here's, if you need to borrow it, here's where the resources are. Here's some people to call. And, and I always felt like we not only were filling the holes, but we were helping raise the level of the rest of the journalism for the rest of the press corps. and have been sort of operating like that ever since. And then, as you know, started picking up, I know we're at 9:01, but started picking up folks who could do, who had expertise. So that's how Tommy Goldsmith started working with me in 2016.
Ah, okay.
We got some money from Kate B. Reynolds Trust to do rural healthcare, and Tommy came on board and worked with me for a few months, and then he needed health insurance, which I couldn't quite afford to give him. So he went and worked for the Indie Week for a year until he qualified for Medicare. And then he came back and worked for me. By then we had some money for aging. So we've slowly built things up. We now have reporters that are concentrating on rural health and Medicare, prison health, something we call gender health, which is a rubric for if there's a tangent of gender, that could be anything from LGBTQ to that's Elizabeth Thompson. She wrote a story about how Black men have higher rates of have a higher death rate from prostate cancer. So if there's a thread, a vector of health in the story, we'll cover that. And gender health, we have environmental health, we have Tommy covering aging, we have Ann Blythe, who's doing work in oral health and children's health. Everybody kind of does children's health. I cover the legislature. Taylor Knopf has really developed an expertise in mental health. I write about mental health too. I'm kind of I'm the person in the press corps who people call when they want to know about Medicaid. Sue, no, we don't have anyone focused on caregivers. Tommy sometimes writes about caregivers, but frankly, our foci are largely dependent on funding. And so that's why, AARP helps to support aging reporting.
Mhm.
Kate B. Reynolds supports the Medicaid and the rural health reporting. ZSR, Z. Smith Reynolds Trust Foundation, they support the environmental health reporting. So we need, because we have to raise all that money, right? And to pay people. And we're trying, and it's challenging because now we're starting to get to a place where it's becoming a little more competitive with inflation. We're raising all of the salaries for our team. McClatchy set a floor. For a long time, I beat McClatchy on pay. I was paying people more than, like Taylor was married to Andy Specht, who was at N&O, and when she came to me, she was making more than Andy was, and he'd been at the N&O for a decade. But now McClatchy set a floor, so we've had to meet that floor. We've had to come up to meet that floor. So, which is good. I really do believe in that rising tides, raising all boats. But and now, it was a real struggle for the first few years. I didn't take a salary for about 6 years, and all the money I raised, I would send to other people. And the thing that I would always say was that my husband does well. He's an engineer. Thank you, Duke. And although it pains me to say that, and I would say to people, and I've been very overt about that for years, that journalism needs a business model that's sustainable. And it should not be the purview of a suburban housewife with a husband with a good job to save American journalism. There need to be business models, and there need to be funders to fund it.
Mhm.
And so that's why, that's been the other thing that I preach all the time, is that, people talk about how important journalism is, but they need to fund it, and they need to be subscribing, and they need to be telling funders to fund it. Just had a long conversation yesterday with Angie Newsom, who's the founder of Carolina Public Press. And after 11 years, she's thrown in the towel. She's like, and we were talking, and she said, they're looking for a replacement ED, but she said, I'm tired of the nights where I wonder if I can pay my team. She said, it shouldn't have to be this hard to produce journalism. And they just had a big win. They had a national win at Carolina Public Press. Their series of stories about sexual assault nurses
Oh,
produced legislation that was sponsored by Deborah Ross, and it just made it through Congress. It's on it. I think it's on its way to Biden's desk, or he may have just signed it. And, you know, they had they had national impact, and now, you know, but she's just tired. She's just really tired. So it shouldn't be as hard as it is to keep this going. And Jeffrey, Travis Long is one of the nicest people I know. I love Travis. He's a great guy.
Thank you,
So-
Jeff, for putting that in the chat. And
Yeah.
I saw your hand there, but Rose was in the middle of her story. But Rose, this has been this has been amazing, and thank you so much for joining us today. Unfortunately, we do need to close it down, and I know you told us that you couldn't do it in less than 3 hours, and you're doing it in much less than that. But everyone is stuck with us here, and we're going to have a great recording that we'll put up on our website. But we need to continue to connect with you and figure out a way that both our coalition, and I'm sure that Heather Burkhart would share that the Coalition on Aging should be engaged with you in greater ways as well.
The Coalition on Aging is, I mean, that, you know, Tommy attends all those meetings, and you know, and he gets lots of story ideas from those meetings. So, and I do, since I'm here and I'm the ED of a not-for-profit, I do have to ask for donations. We're in the middle of a fundraising campaign right now to support Elizabeth Thompson, who's our Report for America core member. She's the one who covers the prison health. You want to talk about an undercovered population, right? No one's really covering that. And so, you know, as I was saying on Twitter about, I think, vote early and often, donate early and often.
I'm sure Mary would say that.
Right. So, well, thank you for giving me the opportunity. I tried to talk as fast as I could. And it's been a weird journey. You know, I'm a Grateful Dead fan. It's been a long, strange trip. And so sometimes it's hard to explain it, you know, so anyway.
Oh, and you couldn't have more enthusiastic followers than these folks here. So let's do this some more.
All right. Well, that would be great. Thank you so much for inviting me, David. It's been a pleasure.
Absolutely, Rose. Great to have you with us. Thanks so much.
Take care.